If you're watching this video, you may have been prescribed Raloxifene, also known by its brand name, Evista, as your osteoporosis medicine. This video will hopefully help you if you're starting the treatment or if you're deciding if it's right for you. Raloxifene is an osteoporosis medicine that makes your bones stronger and reduces your chance of breaking a bone. Bones are made of living tissue. The inside of our bones is constantly being broken down and rebuilt by specialist bone cells. As long as this process is in balance, your bones should stay healthy and strong. But if the process becomes out of balance, our bodies can start to break down more bone tissue than we build. This can cause the bones to become weaker and more likely to break easily. Raloxifene works by slowing down the cells that break down bone. This helps to restore the balance and make your bones stronger. It may also reduce your chance of breast cancer, which is an added benefit. It is only suitable for women who've gone through the menopause. Women often take Raloxifene for several years, as it's a safe and effective medicine. It can sometimes cause menopause-like symptoms, such as joint pain. It's usually not a suitable medicine to take in later life, as it hasn't been proved to reduce the chance of a broken hip, and it slightly increases your risk of a blood clot. Both become more of an issue in older age. The idea of starting an osteoporosis medicine can be worrying, but Raloxifene is a simple tablet that you take each day. Our volunteer Debbie has kindly given her time to share her experiences with Raloxifene.
So in October 22, I was experiencing some back pain and went to see a consultant about my osteoarthritis. And during that checkup, I also had an X-ray, and they found that I had a spinal fracture that had gone undiagnosed. A few weeks later, I had a DEXA scan, and the scan showed that I had osteopenia rather than osteoporosis. This meant that my bone density was lower than the normal adult range, but not yet in the osteoporosis range. So after being found to have low bone density and previous spinal fractures, I was prescribed alendronate. Unfortunately, I had a rare reaction to it, which made me incredibly ill, and I could barely move after taking it. I was then switched to risonadrate, another biphosphonate medication, but after just one tablet, I had a really bad reaction to that as well. My GP then suggested Raloxifene, which isn't a bisphosphonate, so works in a different way to alendronate and risodronate. Thankfully, since starting Raloxifene just over a year ago, I've had no bad reactions or side effects at all. I haven't had another DEXA scan since starting on it to check progress, but so far I feel really good. I generally try to avoid taking medicines because I've had bad reactions to them in the past. I knew, though, that I had to do something. I didn't want my bone density to decrease further. Still, after my bad experiences with alendronate and risonadrate, I was quite nervous. And to try and ease my concerns and understand the treatment a bit better, I reached out to the ROS nurses over email, and they were incredibly helpful. Their reassurance, along with my doctor's recommendation, helped me to feel confident about starting to take Raloxifene. Thankfully, I haven't experienced any side effects, and I'm 1 year into treatment now. After my issues with other medicines, I was relieved to find something that works for me without causing problems. It's also so very easy to take. It's just one daily tablet I take with a glass of water, and you don't have to follow strict instructions like you do with the bisphosphonate. So it's really easy to take. Comes in blister pack. Just pop one of the tablets out. Take with water, and it's just so easy. If you've been recommended Raloxifene and you're unsure, I'd suggest looking at the ROS website and the ROS forum on Health Unlocked. There are lots of people on there who've had similar experiences, and I can't tell you how helpful they were for me. It really helps to know you're not the only one going through these things. I'd say have faith in your healthcare provider, but also do some research for yourself. The more you know about these things, the more questions you can ask, which helps to find something that works for you. I'd also say, although this is easier said than done, try not to let bad experiences with other medicines put you off them completely. It wasn't until my third attempt that I found something that actually works for me. Knowing there's a review plan motivates me to keep going and feels helpful. Just going on for years taking a drug didn't feel right at first. But it's just like people taking medicines for long-term heart health. It's working away in the background, strengthening my bones. It would be good to have a way of knowing if Raloxifene is working. We want to see our bone density improving as a sign the drug is having an effect. But I appreciate scan results don't explain everything, and know that regular scans aren't always offered. I'm scheduled for a review in January 2026, and in the meantime, I remain in close contact with the ROS forum. I also do yin yoga weekly, which really helps, and I'm introducing strengthening exercises to further support my bones. I hope hearing a bit about my own experiences can help you decide about taking an osteoporosis medicine. If you're unsure, the ROS website has lots of information and support to help you feel confident about your treatment.